something that you should definitely be thinking about before you head outside. You really can't avoid it. Dr. Heidi Sapp joins us this morning with some prevention tips. Thank you for being here.
Yeah, thanks for having me.
And I really think it is important. Just how common, though, is skin cancer?
Yeah, skin cancer is very common. It's the most common of all cancers. There are more cases of skin cancer than there are of lung, colon, and breast combined.
Really? But we don't really hear about it as much.
Absolutely, yeah. Nearly 50% of all people that live to the age of 65 will develop skin cancer at least once in their lifetime.
Wow.
And more people develop skin cancer from tanning beds than develop lung cancer from smoking.
Wow, I can believe that. Now, what are some types of skin cancer? I'm sure there's certain degrees.
Yes, there's three different main types. The most common is basal cell cancer. It is the most easily treated.
Okay.
The second most common is squamous cell cancer.
I've heard of
Absolutely. Most people have heard of melanoma.
Right.
While melanoma only accounts for 1% of all cancers, it's the most dangerous and can cause the most deaths.
Now, can you, I'm sure anything can sometimes be prevented. Skin cancer, can it?
Yes. There's great ways to help prevent skin cancer. It's important to avoid sunburns. They say more than 5 sunburns in a lifetime can double your risk for melanoma.
Uh-oh. Okay.
Yes, which all of us have had.
Exactly, yeah.
It's important to avoid tanning beds. Tanning beds are, with the UVA radiation, is a known carcinogen.
Yeah.
Important to seek shade from 10 o'clock to 4 o'clock.
Okay.
Those are the most harmful rays where you're going to have the most dangerous exposure.
Okay.
Make sure you apply sunscreen. Use an SPF of 30 or greater, and then remember to reapply it every 2 hours.
Okay. Now, when is the best time to start prevention? Is it good to start, especially if you have young children? You know, is there a rule on that?
Yes. Well, with sunscreen, you can't use sunscreen if it's 6 months or younger.
Okay.
So once they're 6 months or older, to start using sunscreen. Before that, just to use different sunblocks or shirts or hats and stuff to help protect yourself. The earlier, the better. It's that young exposure and those sunburns repetitively that are going to increase risk in the future.
All right. So what are some things that people should be looking for that could be some warning signs?
Absolutely. So warning signs you want to look for. If you see a change in size of a mole that's getting larger, that's a warning sign.
Okay.
If you see a change in the color or different shades within the mole, if you see irregular borders, most moles have a smooth border,
True.
where melanoma will have irregular borders, and then any persistent bleeding or any sores that don't heal. All of those would be warning signs that you want to look further.
Okay, folks, so please get checks, and if maybe they missed some of that information or was maybe a little bit too much for them to take in at one place, where can they get more information about it, Dr. Sapp?
If you have any questions, feel free to call Charleston OBGYN. Our phone number is 843-740-6700. Our website is charlestonobgyn.com.
All right, thank you so much. Some great information. Please get checked.
Thanks.
All right, well, vets, jets, and chefs are coming together for a good cooking time.